Assalamu alaikum, everyone. This meeting was also announced on a short notice. So, well, as many of you as you can attend well enough. Towards the end, I might take some questions, and those who cannot, I'll upload this on YouTube. So, not a big problem. So, what I have seen recently is that um, a lot of people who do discuss their exams with me, or who have unfortunately failed, or who do take mocks with me and they're stressed, I clearly see a difference between their performance and people who are a bit content and have good control on their stress. Now, talking about stress due to exam, Lab 2 is an expensive exam. Of course, you're paying for academies, you're paying for mocks, residents, your your food and everything. It is costly and it affects people. And some people are dependent on the parents, some on their spouses, some have collected everything that they could. So it is sort of the financial burden, I believe, that strains a person up and stresses them out more than the exam in itself, because the exam is really easy. What happens then is, because you have all these stressors, you want to give your all, so you read as much as you can, because obviously all our life we believe that reading more affects as a good performance eventually. And unfortunately, PLAB 2 is not that sort of an exam where reading more helps you. It's more of a practice, it's more mathematics. So the more you do a mathematical equation and again, you're able to apply it on different numbers, on different sets of algorithms and all, exactly in that way. In PLAB 2 exam, if you have practiced enough and your tongue has drilled through all the interpersonal skills, managements, data gathering points, you perform better. So it's basically practice and it's not a lot of reading. Firstly, I wanted to clarify this. So under stress, what people do is that read to just give themselves satisfaction that I'm good. And it's not going to be a problem because I have read almost all notes from every academy, every place on earth that I could, and I'm ready to take the exam. And I feel like for PLAB 2, the most you need to read is like 7 days. That's it. After 7 days, there should be no reading. There should be more practice. And every time you practice a case and someone tells you missed out this, you should just go back, see that notes, whatever the note said. And by the end, I believe you don't even need to see the notes because you remember it so well once you've practiced a case. You will never make the same mistakes again. That's guaranteed. That's something that I've experienced, and I believe a lot of people have experienced as well. I'm not sure if I'm audible. Do you guys, can you guys hear me? Because nobody has said anything so far. What if I'm talking on mute? Okay, cool. Cool, I'm audible. So now again, how do we deal with this stress? Something that's affecting your performance, something that's making you cancel the exams, something that's just stressing the hell out of you and you're just unsure of it. So I'm going to categorize it into two pieces. Firstly, I'm going to talk about the exam in itself, what it is, and how do you exactly need to deal with it. And then we'll talk about what to do if despite you do all of these things and you still have stress. So firstly, coming to the exam, for all those people who have a lot of stress, who are going to go sit the exam the first time, or they're going to sit the exam second, third, fourth time, I just want you to know that you've all done your basic training, that is your medicine degrees, and after that you've done your internships where you did sit in outpatient appointments. What are outpatient appointments? So you're sitting in your medicine rotation and you have patients, some are complaining of back pain, some are complaining of headaches, some are complaining of tummy pain, some are upset because you didn't redirect them, some have the tests and they are unsure where you need to go. So these are the things that you have faced in your outpatient appointments. Sometimes you're able to deal with them, other times you're unable to deal with them. Sometimes you encounter patients who you're trying to convince and tell them that this is wrong with you, but they're so much in denial and they're so sure that they're fine that they refuse everything. Sometimes it's the financial issues people refuse treatment for. Back at home, I'm comparing that. I'm trying to tell you that we have seen all of these patients. It's not out of the blue or a new thing or a completely new experience for all of us. We have attended emergencies, we have attended medicine cases, and when we're dealing with medicine, we're always counseling people. We have done our surgery rotations, And in surgery, we have told people that this is how the surgery will go, this is what we're going to remove, these are the things that can happen. Anyone who has not done that during their internship, well, it's a big problem. Why haven't you done it already through your internship? But anyway, I feel like we've all done it. We have all done an internship where we were drilled, where we had to go through a schedule, where we had to deal with all these things. So it's nothing new. What happens on the exam day now is it's exactly the same thing. All these simulators are your patients, exactly how you have patients back home. They're nothing, there's nothing new about them. They're not doctors, they're not qualified. They're just normal people with problems sitting in your cubicles. And when you tell yourself that these are not patients, they're actors and they're assessing me and they have to do this and I have to be this, I have to be that, that is where you fail. But if you tell yourself, you calm yourself down and you read and the whole stem outside, and you, once you've read it, you know, okay, this is what the person inside is going to ask of me. Just remember, this is a normal day, like a normal Monday, Tuesday, Wednesday, whenever you have outpatient appointments or outpatient checkups or clinical checkups, whenever you have, just tell yourself that this is a normal day where I have a patient in my outpatient department who has come with this complaint or who has this issue or who's upset about this particular thing. And I just have to talk to this person the way I talk at home, the way I have been convincing people at home, the way I am communicating at home. So if you tell yourself that, it takes out the whole exam picture out. You're not concerned with the examiner who's watching you there. You're not concerned with the observer sitting there. You're not concerned with anything, because now you're literally doing a proper consultation, where what the consultation that you would have done back home as a junior doctor. Please take it as a normal day. All the people who make a havoc out of this and who make it like a big day, that I have to look like this, I have to do this, I have to be that, all of them fail, because what happens is you're so under stress. You are so under stress that you're unable to meet and greet properly with the patient. So you're panicking and you're like, how can I help you? So because I need to get across the how can I get help you introductions, everything in the first 10 seconds. Come on. Do you meet people and you greet people in 10 seconds normally? No, you don't. You engage with them properly. You make a good introduction. You make the person comfortable and then you talk. So why are you ruining your exam when they've told you that take this as a normal day, a normal exam day, right? So when you don't do that, so you start with stress, you don't give a good introduction, you're panicking. When you sit, you're shaking in your chair, you're moving in your chair constantly, you're making uncomfortable positions, you're not making eye contact, you're looking at the walls to recall your questions because you're scared that there'll be a time where you will zone out and you won't be able to carry a conversation, or you will forget what to say, or you're so much in a hurry to reach the diagnosis that you forget to elaborate the symptom. Sometimes what happens is when you catch the diagnosis in the first or second question, which most of the doctors did, they straight away land on the first or second question to reach the diagnosis because they're panicking, they're dealing with their anxiety, and they reach the diagnosis. The moment they reach the diagnosis, they don't care about differentials, they don't care about other things. What happens as a result? You haven't done anything and you've gotten into your comfortable zone because you just got the diagnosis. That's the most important thing. And you just need to give him the 7 steps of management or her 7 steps of management. Again, your stress is affecting your performance. You're not listening to the whole story. You're not elaborating the chief complaint. By then, you've even forgotten the chief complaint because you're stuck with your diagnosis. And you're just drilling through the questions. You're not engaging with the patient because of your stress. What happens eventually? You give the 7 steps of management like really nicely and you fail. Why do you fail? Because you weren't firstly engaging with the patient. Your data gathering was deficient because your questions finished the moment your stress was over, the moment you realize that, okay, this is a diagnosis, now I have the diagnosis, I know the case. The core of the exam is not knowing the case. The core of the exam is proper consultation like a normal day and communicating effectively with the patient. That is exactly what they're demanding from you. So then what happens? That's the first place where it affects. The second place is an examination. You feel like saying head to toe exams will save me. No, it doesn't. You have to focus. You have to verbalize what is the focused part. What are the differentials that I'm ruling out? You focus on those, you verbalize those tests, you verbalize those examinations, and you then are a safe doctor. You're then a focused proper normal day clinician rather than an F2 who's running here and there and trying to quickly wrap up things. Now, if we enter management, again, the worst part of stress is management, where you're so stressed that I have to manage in 2 minutes all of the 7 steps. And you end up not listening to the patient. Or if you do an ICE, like concerns, what is your concern? What is worrying you the most? You don't ask why, you don't address the concerns, and you straight away go, well, from what you've told me, what I understand, blah, 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 this is your problem. This is what I will do. This is what my senior will come. This is blah, blah. You're just going on and on and on about those things. Again, a fail, because what did you do? You didn't listen. If you do listen and you're stressed, so the patient gives you one question, and because of your stress, you're unable to interpret, you're unable to understand what the patient is saying, you end up answering something absolutely out of the blue from somewhere else, from some land far, far away. You pick an answer and you give it to the patient. Again, a major reason why a lot of people fail, because that doesn't make sense. So if I ask you that, doctor, I'm not going to the hospital, or I don't want to stay in the hospital because a lot of people die in the hospital, or I'm not happy with the way my parents were dealt with in the hospital, so I don't want to stay in the hospital. Now, the logical answer is that, well, everyone has different experiences, but in your case, this is what I would prefer, or I would do myself, or I'd try to look into or help you. But when you're stressed, what do you end up saying? You end up washing the head of all the doctors in the NHS. We're very good. We're working 24/7. We're doing everything for you. We're trying to help you. But that doesn't make sense. He's saying something, you're saying something. Then the patient says, doctor, how would, what are the things, you're a doctor, why don't you help me? So you end up telling him that I'll do blah, 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 7 steps of management. Again, wrong. How will you help him? Just start with a snippet and do and see if he's understanding. He's ready to accept what you're saying or not. Am I making sense so far? Because what I'm trying to say here is that you need to understand what the simulator is saying, what are their questions. And if you're out of your stress, you walk out of your stress levels, you will be able to understand the questions are very, very basic. They're very, very easy. They're all from the concerns that you've already read, but you just need to understand what they're asking and not reply with what you've read in the script. You need to reply with your own senses. You need to reply with your own medical knowledge, your own skills, because I am tired of repeatedly telling people that when you are stressed, you memorized some sort of notes, and the patient tells you, what will you do for me? And does, that's it. You're going on and on and on and on. Maybe he's asking about something else. Maybe he's asking, he's redirecting the question to, because I feel like I have cancer, what will you do for me now? He's coming from a different place and you're totally focused on a different thing. This happens when you're stressed. When you're stressed, you're not listening to the simulator, you're just yourself. You think you need to get across all the things in the script. You need to get across the case by knowing the case, and eventually, what is the end? The end is a score of 5, a score of 4, a score of 6, and you fail. So you really, all of you who are listening to me, you really have to get a good grip on your stress. Leave it out. Think of it as a normal day. Or if you can't think of it as a normal day, think of it as, a friend of yours who you haven't met in 10, 11 years and who has come and is sitting in your drawing room to discuss a problem that they have faced or to discuss an issue that they have. That brings a lot of friendliness out in your behavior, in your consultation, because you're not going to talk like a robot to a friend. You're going to engage with the friend. You're going to show the friend that you care about them. You're going to be centered to the concerns that your friend has, or or a sibling, or make it a parent, anyone who you feel like is very important to you. So the simulator needs to feel really, really precious and really important to you when they're in the cubicle or when you're having an interaction. That is the only way to get across with a 9, 10, 11, 12 sort of score. Otherwise, if you're going to carry on with stress, it's not going to help. Now, how do you control the stress with all of these things going on? And this person failed, that person was really good, that person was excellent, he scored blah, blah, blah scores in the academy. What happens in the academy? They assess you on a scale. They have a number of questions given by the owner or whoever it is, eventually they have their own set of concerns and precise answers to those set of concerns, and that's what they're assessing you. They're not seeing your consultation, they're not focused on how are you natural, are you not natural, are you engaging, you're not engaging, are you trying to make an eye contact. None of these things are seen in the academies. So you have to really look at how you're interacting with people. A good way is if you have any friends who you're doing cases with online. I feel like online video practice is really helpful. So if you're practicing online with someone, record yourself online. And when you record yourself, sit at a distance where you can see your own body language, where you can see how you're engaging. And you will see, you will make a massive change in 3-4 days when you see your own consultation. Believe me, the amount of insult a person feels when they see their own consultation is incomparable to my insult or anyone else's criticism or anything. So if you record yourself and you see yourself a few minutes later, you will pick up all your mistakes. You will see that in the consultation, your fingers around your cheek, or you're trying to bite your lips, or you're trying to touch your head again and again. You're not making eye contact. Your eyes are rotating here and there. You will see all of these things in your consultation, and you will fix them the next time. That's a guarantee I'm giving you. This is the best thing that can help you. This will eventually reduce your stress, because when you're recording yourself, every time you're talking, you're seeing yourself and you see an improvement from who you were a few days ago or a day ago or 2 days ago. And it really works. It is so beneficial. I've seen this work for a lot of people. The other thing is, just take my word. I'm giving you my word here that the exam is extremely easy. You only fail when you're stressed out, and I've given you the reasons why that happens. You really have to tell yourself, it's just an ordinary day. I just have to walk in, be myself, and just give the exam, and that's it. The other thing you can do, some people do try beta blockers to keep tachycardia under check. You can try anxiolytics. They help a lot as well if you take a Loraz or Midazolam or any medication at night or a day before. Just take that, and that will control your stress as well. Because when you are stressed, there's adrenaline, and it's just flight or flight, and it just affects your understanding, your comprehension of questions, and eventually your performance. So all of these factors are affected by stress. I'm telling you that stress is the number one factor people fail. The next in line after that is people who take the exam very lightly and don't study at all. So you have to sort of keep a balance between all of these things. I think I've spoken enough about stress. I've tried to explain what it is. I've tried to give you how you can go about it, how you can fix it. Start early, start slow, keep your pace slow. Don't try to rush through things or make it very difficult for yourself, but do quality practice. Quality practice is much better than quantity. And eventually, the consultations are so small that you can literally finish them in 5 minutes. If you are directed, if your stress is under control, you understand the questions, you understand where the case is going. You only take it to an 8th minute or 7th minute onwards when you're stressed, you're not understanding, you're doing a lot of all rights, or you're doing a lot of I'm trying to recollect my thoughts. So that sort of stuff delays it. Otherwise, the consultations are very easy. You need to think you're in an outpatient department and you're really happy today, and it's a very good day for you, and you're engaging with everyone, except inside cases or breaking bad news, which are going to be 2 or maximum 3 cases on the exam day. So questions now, any questions with regards to this? Not anything else, just with regards to anything about the exam day and how to go about it and all. I'll unmute you all now, those who want to unmute and ask a question.
Dr. Aisha, when was your exam?
Oh, well, I've given it a year ago. More
Right.
than
did you attend any academy?
No, I didn't. I just studied myself, and I took a few mocks, but I was redirected because I had this group. I've made this group in a time when I hadn't taken my own exam, and there were a lot of people who were very supportive throughout, who told me, okay, address concerns, don't stress out, it's a normal day. So there were people who were passing and they were giving their input as well into the group, which is a very good thing, that when you pass, give your feedback, that, or when on your exam day, give your feedback that you don't need to stress or you don't need to worry about anything, and like it's a normal day, you don't need to panic or any of those things. So that's what I had a lot of people who could help me out on all of those things.
Okay. And how much did you score?
I scored a 150.
Wow, that's
Thank you.
amazing.
Hello, Dr.
Hello.
Aisha.
Yeah, Sarah.
Yes, Dr. Aisha, I have been told that I am monotonous while I'm giving the station, and my exam is within 2 days, and I went through some mocks in academy, and I have failed all the stations because I am monotonous and I'm lacking of rapport. So I don't know what to do in the remaining 2 days. What shall I do?
I have, in fact, I have two cases, two videos on YouTube. One is about the introduction and one is about monotone. So you can watch them. I've literally picked it up and I worked on that throughout those videos, that how you can change it in a day or two, just fix it. So I think that would help you.
Okay, thank you.
You're welcome.
Hello,
Hi.
So,
Dr. Aisha. Yeah, actually, just want to ask that as we are discussing about the stress factor. So my question is that during that 1.5 minute, when we are reading the question outside the cubicle,
yeah.
what you will suggest ideally after reading the question, how should we plan the station in that 1.5 minute ideally?
Yeah, so ideally, if you read the station, for example, I have a station that Amelia has come in with pain in the legs. Please talk to her, manage her, and address her concerns. Now I know her name is Amelia. I know that she has pain in the legs, and I need to address her concerns and help her out. The first thing I will do is think about what sort of introduction am I going to give Amelia. So Amelia, I've come to know that you have some leg pain. I'm here to help you out with that, and we're going to make a good plan and help you and get you out of this. Okay, so that would be my introduction. The first thing will be me. How will I introduce myself to her? The next thing I would try to remember my DDs of leg pain. What are leg issues or any sort of DD? So I'll think of starting from skin and I'll go under to the bone. What could be the problems? So I know my DDs. The next thing is that I will try to know that her job can be, or a lot of walking or a lot of standing can cause leg pain. So I know that I have to do something with the job or her living, or what is it that she does could be the reason. So I'll then make sure that I ask her psychosocial, targeting that the leg pain can be because of a lot of standing or working quite a lot. Do you do any of those things? So I'll collect these three things, and of course I don't know her concerns, what her questions can be, but I would make sure that I address the concerns. So these would be the four things that I target outside after I read the cubicle, the scenario, sorry. So once I go to the cubicle, if I forget where I was, which a lot of people do under stress, or if I forget her name or anything, I'll just pick the paper on my side and I'll hold it in my hands and then just start talking to her and tell her, okay, we're here. How can I help you? I found out that you've come in with leg pain. I'm really sorry about that. Yeah, that can be a problem. And then, go about it. So that's what I did myself, and I would tell everyone to do.
So we can read the name of that person from the paper inside the cubicle as well. If we forget, that
Yes,
usually happens actually.
yes, obviously.
Okay, 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 doctor. Thanks.
You're welcome.
Another thing during Simman, sorry, can I talk?
Yeah, I'm listening.
Yeah, in Simman, they said there is a card box or something like that. And people, when you are stressed, they tend to forget or pick up wrong things. Do we have, wrong marks or something like that? If we pick up wrong things,
What sort of wrong things? I don't understand your question.
there is a card box, and that's what I heard, that we need to pick up things from that. So is it at the first beginning of the station or
I
middle of the
don't think
station?
there is tons of stuff lying there from which you have to pick anything. It's literally not that way. You have boxes which has labels. These are IV fluids. These are adrenalines. These are ipratropiums or whatever. It's just all divided. So I don't think there's
Oh,
something
that's
like
good.
that
That's good.
very obviously written there.
Uh,
Okay.
Actually, I
Okay.
think the doctor is right. In adrenaline, like it's 1 in 1,000, 1 in 10,000. I myself one time picked the wrong one, so the doctor the examiner just asked me, "Are you sure, doctor?" When I
Mm.
saw adrenaline, I picked the wrong one, so I just put it back and took another one. So he's right. Sometimes they do things like that.
Mm.
You
Like
know,
let's
my
suppose
friend,
Let's see
for
stress
the
sorry
normal
to,
saline, they may put you like 0.9% or something like that, whereas another one. So same goes for adrenaline, same goes for the glucose. So sometimes they do things like that, but we need to be sure of it, what we are doing.
Yeah, if you're not under stress and you're taking it as a normal day, you won't be making a mistake. But if you are
Yeah,
stressed, of course you'll be picking wrong things. I
yeah.
failed my Simon, and the reason being because I kept calling my Simon John because I had practiced on a pillow called John. I didn't call it the right name. The other reason was the Simon told me, Doctor, I've been using these inhalers, and the inhalers were on the side. And because I was so scared, I hadn't seen a Simon before, I didn't pick the inhalers to check the expiry, to check if they have anything in them, like to explore the reason why Simon had an attack of asthma or whatever that happened, whatever was going on there. So again, very scripted, very, in a loop, not trying to touch, not trying to explore, not trying to be, natural myself. So obviously it is going to affect you. You have to pick the right things. And but it's very clear, like the labels are very clear. It's not like there are tons of labels and it's a register in which you have to find out and pick. So really, if you keep your senses intact, I don't even think opening BNF is such a big problem, provided you keep your senses intact. People who lose their senses and who are scared and you know who are just so stressed, they just keep panicking. Oh, I can't find, and then eventually they lose 8 minutes because they can't find something because they're stressed.
stress is giving, the academy is giving us the stress. That's what I feel.
Let's stop going then. I think academies. And I feel like in academies, the only thing that stresses people is that, oh, this person starts a consultation, he remembers all the questions, doesn't forget anything, he does the past medical history, and eventually that person either barely passes or they fail because the more you memorize things and the more you go in a sequence and you're like a school student teacher sort of a thing you're doing, you will fail because you're not being a doctor, you're being a student who's narrate or you're a student who's literally narrating a table of two in the exam, and maybe they don't want to listen to the table of two, maybe they want you to do active multiplications in the cubicle and you
No,
don't.
that's what the problem is. When I go into the mocks, what's happened? Uh, they're expecting us. They're expecting us certain answers all the time, all the time. So I wasted all my time in data gathering, and when the management comes, I couldn't deliver.
Hmm.
That's what's happening, and my confidence is shattered, and my exam is in 4 days' time. So I don't know.
Telling you all, I think the whole session is because I've seen so many people stressed that I'm literally like I literally take a pause during my mock and I'm like, listen to me. I have asked you this. Does my question make sense? And then they go like, but in the academy they said this. I said, no, you listen to me, use your own brain. What do you think is the most ideal answer here? For example, in the Breaking Bad news, the lady asks you, how long does my husband have, or how long does my father have? It's a very plain question. And most of the times, what I hear in response is, so we have decided that we will not do surgery, unfortunately. Oh, does that make sense? It doesn't make sense. I'm not asking you if you can do a
Yeah.
surgery or not. I'm asking you, how long does he have? And they're like, but it's not written here. I said, when it is not written here, so what do you say? What do I say, doctor? I don't know. What do I say? You say, I don't know. Simple. It's that easy. So, literally, you all need to control your levels of stress. It's a very, very easy exam. Take my word on it. You will fail if you walk there under stress because you will constantly make scenarios and questions in your head that are not asked, and you won't listen to the patient. But if your stress is under control and you know who you are, you know what the patient is saying, you'll be fine. You'll be just fine. Trust me.
Because I believe the knowledge I have, it's enough for passing. But the problem is the people around the academy, they're saying that you don't know this, you don't know that. And then again, I'm going to the mocks and I failed miserably. That's the problem.
I think when people
Sorry.
fail,
Sorry.
I actually congratulate people who fail the exam. Sorry, not the exam, the mocks in the academy, because I feel like you weren't scripted. Congratulations, you failed that. I haven't taken any mocks in the academy, so I really don't know how it works and all. It has to be the
I mean,
exam.
it's always scripted. This is always scripted. They are.
Yeah,
It's
because
always problematic. I
you
don't know about this. And if everybody's saying that if you do well in mocks in academy, that means that you are going to do well in the exam. But this isn't the case.
no, it isn't true.
I've seen so many people doing bad here, doing well in the exam.
And vice versa. Yeah, that's true.
That's true.
Yeah.
That's so true. Because they make you feel drained all the time. They make you feel drained. But you have to do this, you have to do this. Oof, that's the problem.
Dr. Tawfiq, you're really fed up with academies. Like,
Yeah.
I haven't taken any, so I don't know how it works, but obviously, definitely makes an unhealthy environment. I wish they themselves understood that it doesn't have to be scripted. It doesn't have to be a set of questions and a set of answers. Because logically, if the GMC is repeating scenarios again and again and again for the last so many years, they are changing the concerns. That's why they're having the same scenarios. They're changing the settings. They're changing the sort of issues that the patients have. So I feel like that changes everything in the exam. And if you've heard too many scripts, or you've read too many scripts, or you've practiced just scripts, the chances are it'll be very difficult for you to pass. So just take it as a normal day. We're left with the last 3 minutes. Anyone else with any questions, or should I just?
Yeah, Doc, I have a question.
Yes.
My question is, if, like, for example, even if you're clear and if your questions gather speed during the process, would that be considered as a negative mark?
No.
Okay, so it's okay to speak with speed, yeah? It's fine as long as you're clear.
Simulator understands what you're saying. It doesn't matter. You have to
Okay.
be. You don't have to be like really, really fast. But if the simulator understands what you're asking, and at the same time, you're not just asking questions, so it's not a check of a few things. You're interacting, so you're commenting on their responses as well. That okay, that's good to hear. That's reassuring. That's concerning for me, really. So if you can.
Okay, and one more question, Doctor. Is it important to signpost at every step? Like, I've got mixed responses regarding this. Some of them say, okay, you have to actually signpost. I'm going to ask you a few questions personally. I'm going to ask about. Some of them say you don't even have to, you just can proceed because they're after all here for you to ask questions. So,
Signposting is important before you enter lifestyle.
okay.
Other than that, no, just for lifestyle, signposting is important because you're walking out of the case and you're going into someone's personal life. Or if you have to do sexual health questions, so then you need to signpost. Otherwise, I don't think signposting is important.
Okay. Thank you, Doctor.
You're welcome. Okay, I think that's it then. Goodbyes and best of luck to all of you. And I really, really hope everyone attending this today or listening to it passes. Bye-bye. Take care. Allah Hafiz. Assalamu alaikum.